that today. So we have the short lecture, but then we need to talk about ELISA. ELISA is our last hands-on lab, and yeah, I think ELISA is cool because, you know, so far we've worked on bacteria all day, every day in the lab, and this is our only viral lab. So we'll kind of get a sense of how a COVID test works and how a viral test works, how we test for viruses. So we'll talk about mononucleosis today and what that is. Have you guys heard of mono? Yeah, mono, like kissing disease, mono. So we'll talk about what that is. Okay, so let's talk about cardiovascular and lymphatic systems. So again, I won't ask you about any anatomy, but the cardiovascular system, oh, just one more thing. Have I ever told you guys about the bodies exhibit? If you ever get a chance to go see that, I think they still have it in Las Vegas, but they travel around. Very cool.
They
so the
here in South like several years ago.
Oh, they did?
Yeah, but they stopped coming here.
Oh yeah, you know, they've stopped going around as much because it's so controversial, like the approval for the bodies and things like that, but of course Nevada's like, come on in. Yeah, so Vegas I think still has it, but if you ever see it, I've seen it once in San Diego and once in Boston, but they plasticize actual human beings. So when they die, they fill their blood vessels or whatever they're looking at with plastic, and so you can see the actual human body parts. And I think what's so neat about it is they make it also into like this art exhibit. It's beautiful, and they do have things like a 4-day-old fetus and like tumors and all kinds of really cool, crazy stuff. So if you have a chance to look at that. But the cardiovascular system, you'll learn about that in anatomy and physiology. But there, obviously, when you have an infection in the bloodstream is a huge problem because then it's a systemic problem because the blood goes everywhere, the lymphatic fluid goes everywhere, all over your body, and then there's more of a systemic problem. So the lymphatic system, we covered the organs of the lymphatic system. So let's talk about malaria. So what organism causes malaria? Plasmodium. Yes, Plasmodium falciparum. Yes, Plasmodium falciparum. Don't forget that for the final. Malaria. I think I might have highlighted it for this one too, but and then HIV is human immunodeficiency virus. So that's the virus that infects CD4 T cells. So that's part of our lymphatic system. Malaria is a bloodborne. It's insect transmitted, mosquito transmitted infection of protozoa. This is a virus. Endocarditis is an infection of the endocardium. I'll show you a picture of that, and that can be a couple different options. We're going to talk a little bit about sepsis and septicemia and what that means. So sepsis is a huge problem at the hospital that we'll talk about and why we worry about that so much. Lyme disease is actually more common than you think it is. That's a bacterial infection, and that's, remember, transmitted. We talked a little bit about the reservoir vector host, and we talked about the reservoir was the deer or the squirrel, and then the vector was the tick, and then the host was the human, and that is Borrelia burgdorferi is the organism for that. You don't have to know that because it's not on our note cards, but it's bacterial. And then mononucleosis, that we'll talk about that as virus. So we're not going to talk about the plague because it's not common anymore, but that's a bacteria. Remember, that's the Yersinia pestis it was from rats, fleas that bit rats. Tularemia is a bacteria. Tularemia is actually a little bit more common. That's from a bacteria. Hemorrhagic fever. So I'm sure you guys have heard about Ebola. Have you guys all heard about Ebola? Yeah, so Ebola is a hemorrhagic fever. That's from a virus. There's also chikungunya or Lassa, dengue, or yellow fever are all hemorrhagic fevers as well. But we won't talk about those, they're so rare. Okay, so malaria, Plasmodium falciparum, non-modal protozoa. Remember, there's the cyst and trophozoite. It's mosquito-borne. So I should have changed this because it's not 40% of the world's population, because I looked that up because I was like, that does not sound right. It's 40% of the world's population is at risk, but I think it's not a small number. I'll show you. I do have actual statistics on that. Signs of systemic infection, so we're looking now systemic infections because we're looking at blood, and the blood is everywhere, all over the system, right? So a systemic infection, infected red blood cells, it can live in the liver, but I won't have you memorize that, but it does go in the red blood cells in the erythrocytes. You look for a blood smear, you can do a PCR. I'm not 100% sure if I'm gonna bring up PCR again, let me think about it, but a blood smear, that was part of our protozoa, our methods to detect protozoa, right, was a blood smear. So here's what I want you to know. It's Plasmodium falciparum, it's malaria, it's mosquito, we know that. Systemic infection, that'll be easier and easier this whole section because they're all systemic infections. Yeah?
So it's not all the symptoms, it's just systemic infection?
Systemic infection means flu-like symptom. Yeah, it's just flu-like symptoms that the patient has signs of systemic infection. Yeah. And then blood smear is what if you guys remember that video where he was poking the little kid's finger, he'd make the little blood smears. Okay, so that was it for hopefully simple. I think the biggest challenge in this section will be remembering Plasmodium falciparum and that it's malaria, but that's part of your note cards as well, so you have to need that for the final anyway. Okay, here's human immunodeficiency virus. This is a positive RNA enveloped virus, so it's a good time to review that for the final, what that means. Remember when we talked about RNA to DNA, and some need to replicate their RNA with a replicase, some need to replicate their RNA with a reverse transcriptase. I won't ask you that now, I will for the final. And then it's a provirus, so remember what a provirus is. They infect CD4 T helper cells. Your patient will generally, not generally, HIV, a lot of people don't die from HIV anymore, but they are at high risk of secondary infection. 39 million people worldwide were living with HIV, that is not a small number. Signs of systemic infection, again, that's easy, right? And then, so I did want you to remember the T cell count. And I don't really care that you know the value. I just care that you know once the T cells drop below a certain quantity, that means AIDS. So a lot of people think like the virus morphed into something else, the patient caught something else, but actually human immunodeficiency virus is AIDS. It's not considered AIDS until their T cell numbers have dropped below a certain value. Yeah?
Slightly related, when it comes to studying the final, or should we be looking at all the outlines from the previous quizzes, or is there going to be a study guide that's going to cover kind of everything?
Yeah, so I've already made it. I can post it. I can just publish it whenever you guys are ready for it. I just don't want to overwhelm you yet because I really want you to focus on the lab practical. But there, I made shortcut slides. But for the note cards are what we're going to focus on the 12th. And it should be anything from the note cards is a go. So think of that kind of separately. But this will help you. It's kind of like an on-ramp. Like this DDX section.
Lab practical as well as on the topic. Like a study guide.
Yes, so lab practical, we're going to do a review session. Yeah, Dr. Walsh. Yeah, Dr. Walsh posted something. I'm gonna post Dr. Myers recorded our last review session, so watching that, and then I'll cover from that video forward on a review session. Awesome, yeah. Okay, so signs of systemic infection, drop below. So any virus, you're valid at this point for any virus. How to test for any virus would be ELISA. After today, you'll know what that means, and you'll know how to do it. And basically what it is a fancy sero test. It's a fancy COVID test. It's just the way we do it in the lab. It's doing the exact same thing. So I'll show you kind of what those mean, what those are. Yes, extremely common around the world. So this is a really good question that I like to ask because here we're looking for, here's our leukocytes, neutrophils, lymphocytes, monocytes, eosinophils, basophils, glucose, total blood protein. What are we looking for with a patient that we might assume has HIV? Close. Close.
Blue T cells.
What are T cells? Lymphocytes. Yes. So leukocytes, when it says leukocytes, it means basophils, eosinophils, mast cells, macrophages, dendritic cells. When it says lymphocytes, that means B cells and T cells. So here you get your patients back and you're like, okay, here's normal range is 5 to 10 times 10 to the 9. This is 6 times 10 to the 9. That's cool. Neutrophils, 74. Maybe they're a little high. Lymphocytes, 16.5. Here's my low value for that. So my patient has low lymphocyte count. That's gonna worry me. And there's some sort of immunocompromised situation going on. There's something going on with my patient's lymphocytes. What is it? It could be HIV. Test my patient. Okay, endocarditis. So the endocardium, there's like a lining, inner lining of the heart. And an inner lining of the heart can get infected, it's a possibility to get an infection from the inner lining of the heart because it's floating around in the blood. And when it's floating around in the blood, it can land on the inner lining of the heart. And if it lands on the inner lining of the heart and sets up shop there, then that's called endocarditis. So it's an infection of the endocardium, of the tissue on the inner lining of the heart. And also they can get an infection in the valves, in the heart valves. So I'll show you a picture. Oh, here it shows you kind of like tricuspid valve damage, infection. So there's an infection in the heart valves. So signs and symptoms are associated with heart. You can kind of say systemic too, like other than systemic, it would be maybe chest pain. I'll skip drug use for a second and talk about that, but nosocomial. So if your patient has a heart valve surgery and is having signs of infection, then obviously there might be an infection in the valve you just put in there, right? Does that kind of make sense? You just put something in there, that's probably where it came from. Sorry, go ahead, Dr. Harrison.
Can epidermitis also cause this?
Epidermitis, not generally. I don't think it's as common. Yeah, but not off the top of my head. Yeah, go ahead.
This is a bit more fundamental, but is it okay to interchangeably use nosocomial in hospital associated?
Yes, yeah, it means the same thing, great, yeah. To keep it simple, signs of systemic infection, yes, maybe some chest pain if it's endocarditis. So nosocomial, if you put something in there, if you put anything in anywhere, that's probably your first sign of infection, your first source of infection. If your patient is immunocompromised, they can get a systemic infection and an endocardial infection just because they're immunocompromised and it came from somewhere else, like a scratch or something like that. But the most common is drug use. So patients that are using needles, or also I want to say drug use, you might have these negative connotations and these assumptions about your patient, but also patients who have to administer themselves like insulin, or that have to administer like a patient that's getting IVF treatment, or a patient that has to do some sort of intramuscular injection or something like that on themselves for whatever medication reasons. But also endocarditis is probably the most common in patients who use drugs intravenously, so who inject heroin or things like that. So that's what I put here. Just know off the top of your head that it can be from something else, but drug use is probably the most common. Aureus and pyogenes are the two most common organisms. Those come up again and again. How we tell the difference between those is a catalase test, or we can look at those in the microscope, right? I'll show you a picture. Here's in the microscope. So a lot of people were confused if they had strep, a strep organism for their unknown. but this is what strep looks like. This is what I want to try and incorporate for next semester too, to give you guys, because we haven't looked at any strep organisms really under the microscope. So it looks, even though I keep telling you it looks like strands, I think it's different when you see it yourself. There's, you know, pearls on a string, it looks like. So that's a streptococcus, that's a staphylococcus. They're both beta hemolytics, so you wouldn't really be able to tell the difference. But staphylococcus is gram-positive, streptococcus is, catalase positive, streptococcus is catalase negative. Okay, so let's talk about sepsis. So septicemia, another word for, so septicemia is the term for infection in the bloodstream. But also it can be called bacteremia. So bacteremia is bacteria in the bloodstream. Septicemia is a broad term for some sort of infection in the blood. So septicemia can be bacteremia, or it can be fungus or something like that as well. But let's just focus on bacteria. So septicemia can lead to what's called sepsis. So I'm going to talk a little bit about what sepsis is. Here are our two main players again, Aureus and Pyogenes. These are our scary ones. Also E. coli. But I didn't have you guys memorize these, but I wanted you to just read through them one time, because I have seen that on a TEAS test. I have seen on a TEAS test Klebsiella pneumoniae. I have seen that a couple times on the TEAS test, and also Pseudomonas. They might ask you about Pseudomonas, because Pseudomonas is also, we're getting more and more worried about Pseudomonas, because actually, even though it is an aerobic organism, that it's been creeping more and more to where it's been like micro air tolerant, so it's actually can survive on almost very little oxygen, so we worry about it more and more. But that's just aside. So Aureus, Pyogenes, E. coli are the most common. Primary, so usually the way people get sepsis is because their primary infection, wherever that original infection was, gets worse and worse, and it will eventually reach the bloodstream. So once it reaches the bloodstream, is it a death sentence? No. Yeah.
My stepbrother had his hip replaced, and he got an infection in the hip, and within 2 weeks he was dead.
That is terrifying. It is so
It
terrifying.
happened really, really fast, and he wasn't that old.
Oh, that is so scary, because they try for any kind of something foreign that you're putting in the body is at such high risk of infection, because they can't clean it well enough. You know, they try, but I mean, tons of people get total hips and total knees, and they're fine. Tons of people get heart valve surgery,
Well,
and they're fine.
He had gotten the surgery a long time before the infection, but when the infection got into his bloodstream, it like sat in the hip, and they could get it out of the other places, but they couldn't get it out of the hip. So it wasn't the hip replacement that caused the infection, but it was what made it impossible to get rid of.
And you know, my best guess is why that is, even though I have no idea, but my best guess is because of the glycocalyx, because of that, you know, they form the biofilm, and you can't get medication into there, and it sets up shop on the metal, on the structure, and so it's really hard to get it off. It'll form like its own little microenvironment where it's hard to get medicine in there, things like that. But yeah, that's really scary. So, you know, we worry about that for everything. For you put your patient on a ventilator, you give them a catheter. You know, a huge portion, I would say all, but not quite all, but many patients that you give them a urinary catheter, they'll get a bladder infection. They'll get some sort of urinary tract infection, because even as clean as you are, you're introducing bacteria up the urethra, which is always puts your patient at risk. So, okay, sepsis, septic shock, and we'll talk about what bonds are. What sepsis is it's immune system dysfunction. So actually your patient is dying from their own immune system. So let's talk about what goes on. So here we start with local infection. There's a local problem. It moves into the bloodstream. Then it moves into what's called sepsis, and I'll go through that. Now your patient is in what's called septic shock, and then multiple organ dysfunction, or MODS. So it's like multi-system organ failure. So the local infection, here's our 3 organisms. It can be from pneumonia, from a urinary tract infection, from a skin infection, from a GI infection. You don't have to memorize those, just know there's some sort of local infection going on. The bacteria will get into the bloodstream. I think this is good to read through these if you're going into clinical medicine. What the problems are as we move into septicemia. 10 to 30% mortality when you have bacteria in the bloodstream. That's extremely high. Sepsis. Now there's a problem with the leukocytes and lymphocytes. Now all of our white blood cells, because there's so much bacteria all over the body, all of the white blood cells are freaking out. So now they're overperforming. There's too many cytokines. There's too much going on in the body. So all of they're degranulating like crazy. They're calling in more white blood cells. There's vasodilation. There's inflammation, and like all over the body now there's a big problem. So one sign of sepsis is low blood pressure. So now because vasodilation, all of the vasculature, the blood will reach the vasculature in all sort of different places, and it takes blood away from the heart. The blood pressure will drop, and 20 to 30% mortality. Septic shock. So now there's organ damage because of the white blood cells. Now all of that white blood cell degranulation and problems will lead to organ damage, 30 to 40% mortality, and then multiple organ dysfunction is 40 to 50% mortality. So that's the progressing to sepsis. So don't forget sepsis, it is from an infection. There was an infection going on at some point, but now it's an immune system problem. Okay. So I got this from the Mayo Clinic. So I think this is kind of cool. I'm sorry, I'm gonna try and read. So this is kind of cool when you start reading stuff. So now that you guys are smarter as far as microorganisms go, you kind of get it more, right? So it's kind of cool, I think, to just when you're reading the research and you're getting more information from like WebMD, now you'll get it more. And so this is something I just found from like mayoclinic.com. Sepsis occurs when chemicals released in the bloodstream to fight an infection trigger inflammation throughout the body. This can cause a cascade of changes that damage multiple organ systems, leading them to fail, sometimes even resulting in death. Symptoms include fever, difficulty breathing, low blood pressure, fast heart rate, mental confusion. Treatment includes antibiotics and intravenous fluids. About 1.7 million cases per year, 200,000 deaths per year just in the US. Extremely common, actually. So what does this mean? Well, sepsis occurs when chemicals, so now you know a little bit more. Chemicals released in the bloodstream. What does that mean? A layperson would be like, what chemicals? What are you talking about? Where there's chemicals in the bloodstream? Where are those coming from?
Histamines?
Yeah, so those are chemicals that are released from your white blood cells. So those leukocytes are degranulating. Now there's cytokines and there's degranulating enzymes in the bloodstream. So to trigger inflammation. Now we know a little bit more about what inflammation is. We know it's vasodilation. We know it's histamine. We know it's heparin. We know it's redness, swelling. The white blood cells are being called to the area. The white blood cells are leaving the vasculature and heading into the tissues. So now we know a little bit more about inflammation. Cause a cascade of changes. So now we know now we're triggering the adaptive immune system. Now our B cells and T cells, we've ignited our B cells and T cells. Now those B cells are secreting antibodies. Now those antibodies are opsonizing and agglutinating and neutralizing and activating. So now we know a little bit more about the cascade of changes. Fever, so we know those are from pyrogens. Antibiotics, we know a lot about antibiotics now, so I just think it's cool that now that you guys are learning a lot more about it, that when you're reading papers or when you're reading the information from the news, you know exactly what it's talking about, or at least more. Okay, so I'm going to show you this video. It's really short.
The medical team in this intensive care unit at Mayo Clinic is on high alert 24/7, watching for signs of sepsis.
Sepsis is a potentially life-threatening complication related to an infection.
Dr. Kenan Ramar says every year, close to 750,000 people in the U.S. develop a septic reaction. It happens when an infection prompts the immune system to kick into overdrive, causing problems such as kidney failure, liver failure, severe drops in blood pressure, and even death.
It becomes very important that this is recognized early.
That's because the death rate can be very high, up to 75% for people who develop sepsis at home, and up to 25% for those who get it in the hospital.
It's almost similar to treating a heart attack or a stroke, where you have a very short window.
That window is 6 hours. Dr. Ramar's team uses what are called sepsis sniffers, technology that monitors things like fever, heart rate, and blood pressure, and alerts the medical team when a patient's in danger.
Okay, I think let's go ahead and activate the sepsis response team.
We have a patient in room number 20. We want to activate the SRT.
If blood tests confirm that's true, the septic response team launches into action.
It's a big multidisciplinary approach to do this. And so all members of the ICU team are actively involved to get this aggressive resuscitation going and to get all things done within that 6 hour period. So let's get the central line ready.
We did give a dose down in the ED, so continue with that.
We follow what we call as the surviving sepsis resuscitation guidelines.
Methods of best practice developed by the Society of Critical Care Medicine to ensure the best possible treatment for patients.
If the necessary things are done, then the mortality drops down dramatically.
Sniffing out sepsis.
Yeah, sepsis is a medical emergency. It's really cool. I think it's interesting to learn about it. I know it's cheesy, but I was getting a little image of you guys in that little room. I'm so excited. I can't wait until you guys are doing all your things and you're out there doing your jobs. You gotta check in with me when you're doing what you meant to do, when you set out to do it. Okay, so here, always having a difficult time getting back into it. Okay, so here, this I just got offline. This kind of helps a little bit. This one before I made this one. So I made this one myself, if that helps. You don't have to know anything in gray, just know the stuff that it's in white. But this I just got offline. So infection, sepsis, septic shock, and then multiple organ dysfunction syndrome. So if you want to do that, if that helps. Okay, so Lyme disease, a couple things. I don't want you to know the organism, just know that it's bacterial, signs of systemic infection. There's a bullseye rash that you want to look for in Lyme disease, but it's not always. So that's something to be cautious of, that maybe your patient has Lyme disease and they don't have a bullseye rash. So, but a bullseye rash will tell you, yes, it probably is Lyme disease. So this is a bacteria, even though this looks like a helmet, kind of, right? But how would you know this is not a helmet in the microscope?
Because it's really tiny.
Yes, magnification, yes, yes, great. So this is 1,000 microscopy with oil microscopy. I'm not sure why what they did to it, but so it would be the point of infection, and then these bacteria move out from this point of infection and cause this thing called a bullseye rash. 10% of patients. Mononucleosis or no?
Are you going to get Lyme if you have a bullseye rash?
If you have a bullseye rash, it probably it is
But
from that
you can
organism.
get Lyme without having.
Yes, yes, yes.
Are you gonna show us pictures like this for the final?
For the final, yes,
Okay.
yes. And you know, more bullseye rash. This is highlighted because I want you to know that. More probably so for the quiz. I'll try not to ask any funky organisms that aren't on our note cards on the final. I'll try and stick with the ones from our note cards on the final, because we didn't do Borrelia burgdorferi for our note cards. So for the final, stick with your note card organisms. If
But like for the quiz, you want
for the
us to
quiz,
know.
no bullseye rash. And
But
no
do you
that
want
it's
us to know the
bacterial.
Borrelia?
No.
Okay.
Yeah.
Despite the bullseye rash, does that mean there's not like integumentary systems that are associated with it?
Yeah, no, yeah, it's not an integument, it's just, that's where it starts, is in the integument, but then the patient has problems with their systemic infection and lymphatic infection. Yeah, and so they'll have signs of systemic infection.
Okay,
Yeah,
so the rash
great
itself
question.
isn't like issue with nickel or anything.
Yeah, no, yeah, yes, not, yeah, the rash is just tells you that that patient got bit by a tick that had the bacteria in it, but then the patient will have malaise, will have fever, chills, things like that. Yeah,
So that bullseye rash is actually where they got bit?
that's where they got bit.
Okay.
Yes. Okay. So mononucleosis, this is from a virus called the Epstein-Barr virus. I just want you to know that it's virally derived. I don't want you to know the name of the virus. It's a type of herpes virus. I don't know if you guys have noticed how many times I wrote human herpes virus on there, the HHV, but there's all kinds of different types of herpes viruses. This is a type of herpes virus. It's called Epstein-Barr virus. And it is an oncovirus and a provirus. So even though 90% of the world's population has been exposed to mono and has antibodies towards the monovirus, towards Epstein-Barr virus, that in some cases, that's where they think that their cancer came from. So Hodgkin's lymphoma or Burkitt's lymphoma, nasopharyngeal cancers, inflammatory bowel disease, gastric cancer, hepatitis, multiple sclerosis, herpes. So all kinds of things that are associated with mono. It's called the kissing disease because it can be passed through saliva. It is a provirus. It lives inside of B cells for a very long time, so it's a B cell infection. Yeah.
Is it true that if someone has had mono, that even like years later, you shouldn't share any kind of, like I had a friend who had mono as a kid, so nobody would ever drink after her in order to avoid getting it later.
Yeah, I should look that up because actually my daughter's really good friend had mono and she was so sick for so long, but I don't know how long, but that's important to look up. I should look that up for sure. How long, because they are, it is highly infectious, and yeah, her face was huge, swollen, she had huge lymph nodes, she felt terrible for months. Yeah, it's a scary virus, but we should look that up. Okay, so that's it for cardiovascular, and we will go down to the lab. You don't have to do PPE today, we're doing, it's a simulation lab.